Welcome to the Fire Rescue Wellness Podcast Spotlight, where we revisit take-home messages and shine a light on previous FRW podcasts in 10 minutes or less. I'm Lex, AZ's right and left-hand woman, and I churn out these mini episodes for her. Let's go.
Just so everyone knows, I mentioned that I had been at a previous physical therapy mill, and then Katie said there's, that one patient that just lights up your day. I'd like to think that I was that one patient. Denise Smith.
Absolutely.
Denise Smith, if you're listening, please confirm. Okay. From the patients,
the only reason they're still practicing is because of you.
Well, and Denise started her own clinic. She moved away, started her own clinic, and I can't confirm that she's cash-based, but I do suspect it. So I should follow up.
Most likely. That's awesome.
Most likely. Okay, Katie, from a patient's perspective, just right before we hopped on the call, I was having a conversation with my man Jeremiah here in the studio. He's the sound guy. And I was just telling him about the conversation that we were going to have, asked him if he'd ever been in physical therapy. And I kind of explained that concept of the mill. And he's like, yeah, I get that. I've experienced that. But from a patient's perspective, tell us about that experience, Katie.
Yeah, absolutely. So this is where I get frustrated because, and we've talked about this before, the perception of actually what physical therapists are and what we know and what we do and the type of school that we've had and the knowledge that we have and the type of conditions that we can actually differentially diagnose, meaning we can rule out stuff that would be not within our scope of practice and refer people to the according professional. People have no idea that we do that. People have no idea that we are doctorally trained. They have no idea that we take the same or even more intensive musculoskeletal and nervous system anatomy than a lot of other medical providers. They have no idea the type of coursework that we do. But I kind of don't blame them for not knowing, because if you walk into kind of the mill clinic that we're talking about, there's 10 tables in a row. There's old carpet and smooth jazz playing, and there are people sitting at computers and feverishly typing notes while a tech hands somebody a resistance band. There's dumbbells that don't go up about past 10 pounds. There's nothing in that facility to make it look like, oh, this is full of doctorally trained experts in physiology, movement, exercise, neuroscience. So I completely understand, while also being frustrated by the fact that people don't know what we do. So as a patient going into these settings, we probably already have a negative connotation and predisposition about what PTs even do, because you just see this setting and not really much is going on. So your perception is already quite low, most likely. And then you go in there and you realize, yes, you're being seen with multiple other patients, and you're probably laying on a table. You're probably paying for heat and ice and ultrasound and things that are actually in the literature shown to not do anything for improving outcomes at all. There's studies that compare the use of an ultrasound that's plugged in and not plugged in, and we have the same outcomes, nothing. So you're in these settings where you're not being challenged, you're not being pushed, you're being treated the exact same way as anybody else who could walk in with your injury, while not being taken into consideration that every single person's injury looks different. Every single person's goals and what they have to be able to get back to doing is different. You shouldn't be doing the same printout sheet of exercises for an older woman in her 80s who hurt her knee and a 16-year-old high school soccer player. But that's what those settings show. So you're getting an underdosed, lower level type of care that's not going to get you back to where you need to be. And it's no wonder that people say, yeah, I tried PT, it doesn't work. Because it doesn't work if the level that you're given for rehab doesn't even come close to what you need to do to get out of there and what demands that your body has to go through for whatever type of lifestyle, sport, activity, hobby that you need to get back to.